By the end of this lesson, you will be able to file patient health records. So when we're learning how to file records, we call this indexing. So if you think of index cards and putting them in order, indexing means putting things in order. So we start off with last names, and we use the last name first in filing. Then the first name is considered, and then the middle name or initial is looked at third. So we begin with the last name, then next look at the first name, and then look at the middle initial for filing. Some other rules that we use is if there are initials that precede a name beginning with the same letter. So you have just a person's initial M, nothing else behind it, and then you have Maggie. Well, the M would be filed before the word Maggie. If you have hyphenated parts of a name, we consider that as all one word. If there's an apostrophe, we disregard it. So we just pretend it's just not even there. When indexing a foreign name that you have trouble telling between the first and last name, index each part of the name in the order in which it is written. So if you can figure out which is the first and last name, start with the last name and then use the obvious first name. But again, if you can't, you go by whatever order the client writes it in and use it that way. If a person has a prefix in their name, it is considered as part of their name. So McDonald's, okay? Mc is considered part of the name. Don't ignore it. A few more rules when indexing or putting things in order are that abbreviations are indexed as if they were written out fully. So if we have an abbreviation SR for sister, we would index it or file it as SISTER. Okay. Mac and MC, Mick, are filed in their regular place in the alphabet. So MAC would come before MC. And remember, those prefixes are part of the name, so MAC would come before MAGGIE, Mac would come before Maggie, and Maggie would come before MC, Mick. When you have people who are married, a married person, we use their legal name. So if they legally go by their maiden name, that's what we use. If they legally go by their married name, that's what we use. If we need, and we have duplicates down the line, the title can be used as the last filing unit. So say you have Smith, John, Robert. And we have two Smith, John, Roberts. Well, the last name, the first name, and the middle name are all the same. So if we have Smith, John, Robert, MD, and we have Smith, John, Robert, RN, MD would come before RN. So we only use these titles or degrees if we are trying to distinguish people who have identical names. And lastly, articles such as the or a we don't use them when filing. So the book, we would drop book and just file it as book. A pen, the A would be dropped and we would just file it as pen. So those simple little articles that we put in front of words or terms, we basically get rid of them or ignore them. Okay, we really have two different types of filing methods that you're going to see, and it really is on the preference of where you are working. So the first filing method we're going to talk is the alphabetic filing method, and that's simply the most common used. It's the easiest to use because all of us know the alphabet. So it is a very simple system to learn. Basically, you just follow those rules of indexing and put the files in order and according to our indexing rules. Now, the drawbacks to this system is you really do need to know the correct spelling of a name. If the name is spelled incorrectly, it's going to get filed incorrectly. And it tends to take up a lot of space, and so what happens is you end up having to expand sections. If you add a lot more S's, you've got to expand that section, and you've got to move all of the others, the TUVs and WX and Ys and Zs, you've got to move all those files down to make room for more S's. So that can be a bit cumbersome in the filing system. But overall, it's an easy system and a very simple system to use and for people to come in and learn. Now, the second filing system we see is numeric. And this is where we combine some sort of numeric filing system with colors in order to put them in paper charts and that in order. Pretty much every large clinic facility or hospital uses some type of numeric system. It allows for unlimited expansion because usually what happens is patients are assigned a consecutive number when they visit the practice. So the first patient is given number 1, the second patient number 2. Usually it's more numbers than that, like 00001, 00002, 0003, and as they come in, we just add them to the end. So we don't have to worry about, uh-oh, our area of S's is getting too big and we have to move all the other files. The downside of this is you do have to have some type of a cross-reference system that alphabetically cross-references so that you can easily find a person's record. Mr. Smith is not going to know what his numeric code is probably for his record. He's going to come in and tell you his name is Mr. Smith, and you're going to have to be able to cross-reference, somehow look up Mr. Smith and find the numeric number that is assigned to Mr. Smith. Now, when you're retrieving a file and having to get the file, it's very easy to locate because you know that 2 comes after 3 and 3 comes after 4, and it's very easy to go pull it and access it. Numeric filing requires more training because you need to learn how the numbers are being assigned and you need to learn how to use the alphabetical cross-reference. However, once you learn it, it's easy to locate, and we see very few errors in filing with a numeric system as compared to an alphabetic system. So that's a great advantage and why a lot of bigger facilities use a numeric filing system. So the primary goal of all healthcare facilities is to provide efficient, high-quality patient care. The ability to easily access our patients' records assists in providing that efficient patient care. So you will need to become comfortable working with the filing system that is in place where you are employed so that you can easily, efficiently, and accurately access patient records.